If you felt amazing and wonderful in your first trimester, maybe you had very little to no symptoms, pop in the comments below your experience. So yes, there will be some women and people who in that first trimester, for whatever reason, they don't have as many symptoms as other people. Around 3 in 10 women will experience no nausea or vomiting in that very first trimester. It is being aware that there are other symptoms though that can have that impact, but there will be some people who have very few symptoms and very healthily continue a pregnancy, no problems, no concerns at all. But in my experience as a midwife, particularly when I used to work in community and book women in their very first trimester, almost all of them would come in and go, oh my word, is the pregnancy meant to be this hard? Is it meant to be this difficult? And so often these women and people feel very alone in their experiences. And physiologically, the body is going through so much and so many adaptations. And as always, it's remembering that we all react very differently to hormones just in general in life. As always, it's remembering that our emotions and our feelings are not binary. It's not like we all come in and go, oh, this is the worst thing in the world and I hate every second of it. You can both hate the symptoms that your body is going through and still be unbelievably happy and elated and overjoyed and excited and amazed and at wonder at what your body is doing and at this baby that's growing in your uterus. And of course, if you're one of these women and people who have very little to no symptoms in that first trimester, yes, while the anxiety can be a little bit higher in terms of not having as many symptoms, actually, you are going to be more happy because you're not having so many symptoms that can make you feel like poo. And so that in itself will make people far more happy in that first trimester. And absolutely, they do exist. I promise you they exist. There would be women who would come in my clinics when I was working in community who absolutely had no symptoms, felt amazing, felt brilliant, had that lovely pregnancy glow that some people get, and were loving their life. And there's a couple of research studies that look at happiness and the associated factors amongst pregnant women. Now, these studies aren't undertaken in the UK, so caution needs to be applied. However, I just want to highlight some of the factors that I think probably most of us could relate to in one way, shape or form. And people who were happiest had planned pregnancies. They also had far more social support as well. People having their first baby were happier than those who were having subsequent babies, and also women and people who were less anxious about childbirth also reported being happier. To conclude, we all react very differently to our hormones. Physiologically, the body goes through so many changes, whether you feel those symptoms or don't. And there are many people who do feel ecstatic and happy and elated in their first trimester, regardless of whether they do have lots of symptoms or not. And if you are one of those people who had little to no symptoms, then of course you're going to feel much better in your pregnancy because you're not tackling those symptoms that happen for the vast majority of women and people in pregnancy, particularly in the first trimester.